Hello, good afternoon. Thanks you everybody for coming. Like she said, I'm a family physician, and so this topic is kind of near and dear to my heart because this is what I do every day, primary care. And so a lot of people are hearing about primary care, like she said, because of NHI. It's becoming kind of the spotlight is on it. So people want to really know what is primary care and what would you expect from primary care. So I'm going to kind of go into defining what primary care is and kind of discuss the impacts of primary care and basically the future of primary care as we see it in the world and here in the Bahamas and how NHI is going to impact all of that. And so kind of an outline of what we're going to talk about. Like I said, what is primary care around the world, changes in primary care, the future of primary care, and NHI impacts. So try to make it something that everybody can gather some kind of information from. And so this concept of primary care basically came around in the 1920s when there was a report written in the UK which kind of made primary care the new kind of cornerstone of healthcare. And this was happening all around the world except for in the United States, which actually as the 20th century approached was into more specialized care. So when we talk about specialized care, you hear about surgeons who specialize in a particular area and persons who aren't a part of the primary care services was really what was the forefront in the US, whilst the rest of the world were embracing this concept of primary care. So the GI Bill of Rights came out and specialization of general practitioners started happening just before the World War. So what happened is they needed more people in specialized areas and the doctors were actually getting specialized, even the general practitioners. And so the ones who were kind of left there they were kind of, what are we going to do? And so they lacked additional training and there was a concern about the survival of the GP or the generalist. And so this whole concept of a family physician came about where you had persons specializing now in the practice of general care. And this happened in the 1960s and the 1970s. And there were longer graduate and postgraduate programs for people who were specializing in primary care. Okay. And so in the United States, this specialized training also covered the general internists as well as the general pediatric doctors. And so working with international colleagues, they established standards for accrediting or making this more credentially based. And this new specialty of family practice came about, which was just basically general practitioners becoming specialized. Okay, so the Institute of Medicine started looking at a more integrated system. So they wanted accessible healthcare services for clinicians and they wanted them to be accountable. And so they wanted to address the large majority of personal healthcare needs and develop a sustained partnership with patients. And so this whole idea of practicing in the context of the family and the community. And so now we're seeing the emergence of practice where it's more centered on the patient rather on the diagnosis. So in the past, medicine was, you had a problem, we diagnose the problem, we treat the problem. But now the concept of bringing a more integrated system came about where you would actually partnership with the patients as well as to take into the context of community and the family and things in the environment. So the primary care physicians or the primary care usually has to do with first contact access of needs. So this is usually your first encounter with the medical system. And it's based on dealing with persons in a more long-term manner, focused on their care, whilst being very comprehensive of their needs. And it brings together coordinating all of the different factors of medicine into one place. So your primary care services basically are the coordinators of your healthcare. So what are the benefits of primary care? Lower cost of care. Primary care is supposed to improve health through access to more appropriate services, reduce inequities in the population of health, as well as reduce disparities in health across populations and groups. And so basically, the benefits of primary care is to make the healthcare system better. You also see that healthcare is better in areas where there's a primary care physician. So they've found, studies have basically found that people who are seen by primary care physicians are basically healthier. And so we look at also the health outcomes of persons in the primary care system. We looked at the supply of primary care physicians and health at different levels, and they separated them by geographic aggregation. And this controlled for various population characteristics showed that the supply of family physicians or the supply of primary care in a country actually led to a better healthcare system. And we look at the number of primary care physicians per population, and that basically is our measure of the supply. Oops. So in the 1990s, they realized with a higher ratio of primary care physicians to the population, there were better health outcomes. There were lower rates of all causes of mortality, and this was for non-communicable diseases like heart disease, cancer, stroke, and there was a decline in infant mortality, so less babies were dying, less babies were being born at low birth rates, and there were less poor reports of health. And so even when they controlled for what people did and what people didn't do and their lifestyles, we found that the supply of primary care physicians, or having primary care as a main focus of your healthcare system, basically improved the healthcare system. So in England, they also found this when they found that there was a standardized mortality was lower because of having family physicians and general practitioners when the ratio of general practitioners to the population was significant. So the increase of one primary care physician per 10,000 in the population basically improves the outcomes of health by 5.3%. And so just by improving primary care services, the United States is estimated that over 100,000 patients could basically be saved or averted from having poor outcomes in the United States alone. So what is primary care? So according to the American Association of Family Practitioners, we see that primary care are persons who provide care that is provided by physicians specifically trained for and skilled in a comprehensive first contact and continuing care for persons with an undiagnosed sign, symptom, or health concern. But this is not limited by the problem of origin, organ system, or diagnosis. So what does this mean? It basically means these are the people who are trained to do comprehensive first contact care. So these are the persons that when you first enter the healthcare system would be the ones to take care of you. And they would have the ability to not only diagnose you, but to follow up with your care and to be able to coordinate your care. So this involves a lot of things. So when we talk primary care, we think about health promotion, which is talking about health, disease prevention, health maintenance, counseling, patient education. So a large part of primary care is patient education, getting the patients and the persons in the community to understand about their health, to understand about disease processes, and understand about how, what they can do to live a healthier lifestyle. And it involves diagnosis and treatment of both acute and chronic illnesses in a variety of healthcare settings. So you find primary care could be in hospital, out hospital, and different places in the community. And these persons or physicians basically collaborate with other healthcare professionals to create a plan for you. And these are also the persons who utilize consultation or referral, which means that if you have a problem outside the scheme of primary care, they would be the persons to send you to the specialist and make sure that you got particular tests done. And this is all based on a kind of patient-centered model. Like I said, we moved away from just looking at the disease process itself, but actually centering our care on the patient and the patient's needs. And this is all coordinated efficiently. And so primary care promotes effective communication with patients and encourages the role of the patient as a partner in healthcare. So you're not just someone sitting in the doctor's office, but you're actually an active participant. So who's a primary care physician? Well, nowadays, we think of the primary care physician in terms of specialist of primary care. So we have the family physician, the internal medicine doctor, so these would usually be the adult doctors on the ward, your general pediatric doctors, who are your doctors who look after children in the community, and they're just the physicians who provide care to a subsect of the population, and they're the first contact doctors. So these doctors take on the responsibility for providing the patients with comprehensive health care. And so they're doing chronic disease prevention, acute care, inpatient and outpatient settings, and basically they have additional training, which is like a residency program where they would go off after their initial degree, and medical degree that is, and do more time studying and doing residency. So like me, I'm a family physician. After I finished medical school, I did an additional 4 years where I just focused on primary care things and learning about the different areas that we would need to incorporate in our practice in the community. So primary care physicians devote the majority of their practice to primary care services in a defined population. So like in the Bahamas or in the clinics, in a specific place. And they can be found at every entry point substantially for all their patients' medical and healthcare needs. And they're not limited by problem, origin, organ system, or diagnosis. So they are kind of almost your one-stop shop in terms of primary care. And they are also advocates for patients. So because of the training, these are the physicians that would advocate for policies, advocate for your health, would put into context all the things in the community related to health and how we would better serve the public and the population's needs. And they're the coordinators of the entire healthcare system and basically looking to benefit the patient. So primary care is a really big job. So is there room for other people? Yes. So physicians who are not trained in primary care specialties also play a role, although more focused. They might deal with aspects of prevention, health maintenance, acute care, chronic care, or rehabilitation. And, but usually it's not as comprehensive as when you're dealing with a primary care specialist. So they're usually supposed to be within close consultation with a fully trained primary care physician. Who else? So there are other persons involved other than physicians. We've got our nurse practitioners, who are nurses who've also done additional study, and we've got physician assistants as well as other allied healthcare workers like physiotherapists who are going to be involved in putting together and coordinating your care. And they meet specific needs for patients. So you can see that a lot of nurses are doing additional care in certain areas, such as community nursing, coming out into the community and actually seeing the patients. And that's where we see a lot of other non-physicians playing a role in primary care. And so it's a collaborative team effort and is led by a primary care physician. So when we look around the world at who has the best healthcare system and who's got the best primary care system, number one is France. That's a country in Europe. And so right next door, the USA, which we kind of always look at their healthcare system and want to be like them, they're actually number 36 in the world. And we can see Jamaica is 53, Barbados is 46 on the list, and Bahamas is down at 94. And what did they do to figure this out? They look at the overall health of the nation, health equality, so looking at how people were able to access care, responsiveness to that care and equality, and basically fair financial contributions and how it's financed and paid for. So why is France so good? Well, it's been said that they have extraordinarily open and communicative with patients and families which reaps significant patient safety benefits, as well as they have a high doctor per capita. So they are open to this model of primary care and where they are communicating with the patients and they're out there in the community and focusing on families and community more so than just disease processes. They have high private and public coverage. So insurance coverage in France is about 95% of the population has some form of coverage. And whether it be public or private, they have health insurance. And they're very efficient in spending their money, so they don't waste their money. They spend a lot on healthcare. We'll see that later on. And they actually use that money wisely. Okay, so this brings about a low death rate, and they're very focused on primary care. So you can see they've got 23,000 general practitioners. Most of them are all self-employed professionals, and the citizens are choose to go to whoever they want as their GP. So they have this very open system where you can go and find whichever GP you want, and basically between public and private insurance, it's taken care of. And a part of the comprehensive approach is to have that personal doctor where you can go to all the time. And they just pay a flat rate of 23 francs, and that is actually given back to them because they already pay into the healthcare system. And so most of the doctors in France are what they call conventioned or have a contract with the government. So basically, everybody can get on board with the government system, and you can see just about any doctor in France. What about the US? Well, they are the most expensive. So they spend more money than everyone else in the world. However, they have some of the highest rates of deaths amenable to health care per 100,000 population. And that was a study done with 19 countries. And their death rate due to healthcare practices is twice the amount as France. So they're spending way more money, but they're not getting the benefits of all that money they're spending not like a lot of other countries, and that's why they're kind of like number 36. And remember, their focus was not primary care, their focus was specialized care. So like I said, failure to emphasize primary care were their problems, low primary care ratings. And even within the US, when they looked at areas where there was more primary care physicians, there were lower mortality rates. So that kind of spells out what their problem was. So they have a major gap between the number of primary care physicians and providers that were needed to deliver primary care to the full population. And so satisfaction for primary care providers in the US was extremely low when it was investigated. And so because of the Affordable Care Act in 2010, they thought there was promise because now you're going to have over 32 million additional people who would be able to get insurance. However, they didn't have the family medicine doctors, the primary care specialists, or the providers to take care of all of these people. And so they had to decide, what are they going to do? You need to either pay primary care providers more or specialists less, because now there was a shift in how they were looking at healthcare, and you needed more primary care to get a better healthcare system. And so they started moving away from paying for specific visits and actually paying, trying to contract doctors, similar to the programs that you see in Europe. And so they are now moving to this shift of primary care being the foundation of their healthcare system. And so that brings into the concept of a new model of the way that we do primary care, which is the medical home, where you basically have doctors and different specialists all together, and they work as a team to give the care that's needed. And this showed really positive results in the States, and this lowered emergency room utilization as well as hospitalization rates from ambulatory care for sensitive conditions, as well as it lowered cost. So they saw better intermediate quality outcomes from just doing primary care medical homes, and additionally adding electronic medical records. So this statement basically sums all that up. It's a fact. US adults who have a primary care physician have 33% lower health care costs and 19% lower odds of dying than those who only see a specialist. As a nation, we should save $67 billion each year if everybody uses a primary care provider as their usual source of care, and that's in the United States. And so this gentleman here, Paul Grundy, who was the person who came up with this whole idea of a patient-centered medical home, he said this about America's healthcare system. He said, an American experiment at providing high-end specialty care without any effort to provide comprehensive, robust, preventative, and primary care that is integrated with care management has failed us all. And he then went on to compare what America was doing, even though they were trying to make changes, and what was doing in places like Europe and Denmark. And he said that even though they were bringing in electronic medical records, it was poorly initiated. They weren't paying their physicians enough money. Although payment for doctors is high in the United States, you'll find that primary care workers actually make the lowest. And so they weren't driving enough people into the field. And the government involvement was highly inefficient compared to in Europe, where it was more efficient. And the drive was basically bureaucracy rather than physician-led. So the government was just saying, we're going to do this. They didn't really take into consideration what the physicians wanted or how they wanted this molded, and that's why they're still having problems with their healthcare system. So the future of primary care is focused a lot on the patient-centered home or medical home, and close partnerships between clinicians and patients, as well as looking at the complexity of the healthcare system. I mean, we live in a society now where people have multiple comorbidities, in which you can have hypertension, diabetes, cholesterol issues. And so a patient walking in is not just a simple diagnosis. They have a multitude of problems, and you have to take in consideration their environmental, social issues. And as we learn in my program, you have to take this now from a more holistic approach, where you look at the whole person and the community. And we have to individualize care. So one standard doesn't fit all. There's usually not an algorithm that fits every single patient. And we have to look to technology to kind of bridge all of these gaps. And we have to look at new pay structures and changes. So this is what the patient-centered medical home looks like. The patient in the center. You see the physician, primary care physician at the top, coordinating all the efforts. And everybody else is a part of the team that basically coordinates the care. And so when we have a patient-centered medical approach, we find that we have our most optimized primary care, in that we can have teams of persons that are going to look at every aspect of the patient's lifestyle. And here this diagram basically shows that adults with chronic disease having problems with coordination of their care, if they don't have basically a primary care physician, it's higher than persons who don't have a primary care physician within a medical home. And we also find that the medical home model actually decreases hospital admissions as well as lower cost. And this also cuts down on burnout for your physicians, and your healthcare workers find that this model is less likely to cause them to have burnout, and is just a more conducive way of dealing with patient care. An example of this is the Horizon Blue Cross Blue Shield of New Jersey. So this company basically saw that once they introduced this model of care, that they were able to cut down on emergency room visits by 26% and hospital admissions by 25%. And their health partners in Minnesota were able to decrease their ER visits by 39% and decrease hospital readmissions by 40%, and reduce their appointment time from 26 days to 1 day. So that bringing together all those different components of healthcare basically streamlined their system and brought down the admissions and the negative health outcomes. And so basically they also pushed this idea of incentives of driving this. And they have 4 million patients in 39 states. And what they did is they actually started paying their primary care doctors and their persons in the primary care field more money. They gave them 12% increase for the usual fees, and then paid them extra to provide management and care to chronically ill patients. So just by taking a patient who was more ill or had a more complex problem, they were able to get doctors to basically personalize the treatment plans, conduct proper follow-up, do more thorough phone calls, out-of-office visits, basically work on achieving positive lifestyle and changing things like smoking and other problems. They were able to get more incentives, which drove the persons involved to basically cover all those areas that were lacking. And to take it a step further, the community-centered approach basically does a similar thing, but now bases that on the community. And what that does is you now look at which policies would actually affect healthcare. And so you're looking at healthcare from a greater standpoint. And this is really what I call true primary care, because you're not just looking at an individual, but you're looking at the health of the nation. And this is probably the approach that we're going to be moving forward to. So the elements of a community-centered health home or community-centered approach is inquiry. So you have to do your research. You have to find the data in order to improve the system. So this is finding out your socioeconomics of your patients, what things are driving certain habits, all of that information, analyzing it, and then acting on it, and using that information to create the policies and the framework for a healthcare system that's going to improve healthcare in the Bahamas. So the capacities needed for an effective implementation is proper staff training and continued education. So we have to focus on training persons in this area so that we have enough staff to basically do the things that we need in primary care. And you need a dedicated and diverse team as well as innovative leadership. So in order to change any system, you're going to have to ruffle some feathers. You're going to have to change the culture of the way that you do things. So removing inefficiency, doing things new way, bringing in technology. And that requires innovative leadership. And that's really what is going to drive changes in healthcare in the future. And so the overarching systems or change that's recommended are to the structural healthcare payment system to support your community-centered approach, leveraging the current opportunities for government, philanthropy, and community benefits to support. So bringing together private, you hear this word, this thing now about public-private partnerships, and that's what this concept is, bringing everybody together to support the healthcare system, and establishing consistent metrics and for evaluation and continuous quality improvements. So you have to have something to measure this by. We have to look to the future and say, where do we want our healthcare system to be? How are we going to measure that? And how are we going to continually try to improve the quality? So we have to monitor what we're doing. And we tend not to do that. We tend to implement things and then we don't monitor to see if it's working. And basically strengthening and utilizing health provider networks. So bringing all of these people together is going to be an important aspect of primary care. And having a field or a cadre of healthcare professionals who are prepared to work in this system. So you might have to do a lot of retraining in terms of the way that people look at the healthcare system and how they're working currently in the healthcare system. So we have to invest in technology and basically web-based systems for scheduling and communicating with patients. It's going towards the point where we're going to communicate with patients more online. And you have to have the teams to treat the patients appropriately for the chronic illnesses, multiple chronic illnesses who require extra levels of care. And you have to look in health insurance to pay for this care. So at some point, someone has to pay for the care, whether it's the government or the people. Either way, the money is going to come out. So health insurance or some type of system where everybody's care can be paid for is really what we encourage. And basically, encouraging and rewarding delivery of care. So if you're expecting all of this coordination and to come together, then you really need to look at encouraging and rewarding care of the persons in the field. So the overall goals for primary care is to improve healthcare outcomes, reduce the expense of healthcare, reduce the frequency of emergency visits, avoid hospitalizations, and reduce the costly move for patients further in life. So we want a healthier nation that doesn't need to be placed in homes. And that involves also changing the payment scheme and to a more performance-driven manner in which we look at what you're doing and what are your outcomes, and that's how you get paid. And just some things that are happening in the United States, like accountable care organizations, where they go in and they look at what the doctors are doing and kind of analyze that. So we have to meet the demands of persons also with low income. So if your primary care is going to be effective, everybody has to be able to access it. So we have to look at being able to deal with that, as well as increasing the pool of primary care providers and changing the patient care delivery system. Our challenges, a lot of people want to go into specialties, but in the Bahamas we need both specialists and family care physicians. We also have technology, which is a blessing and a curse, because you have roboticization coming up where they're actually trying to replace some of the things that doctors and care providers do with robots. And you're seeing in some areas where they're using less physical examination, but using diagnostics as the only tool. But here in the Bahamas, we have a strong clinical focus to our practice. So I don't think that's really a challenge here. And then just making the field more attractive for physicians. So technology, electronic medical records. So some persons have already initiated this, but we find that just by bringing in technology, you have an increase in the readily available of a patient's notes or access to everything about the patient increases. There are numerous clinical benefits, and it's just found to create a better patient care. Also with technology is the concept of telemedicine, emailing, and home monitoring, where we'll go into a little bit. When we look in terms of electronic medical records, we find that it provides reduced errors, improves patient safety, as well as improve patient outcomes. It also improves the risk management, so it decreases your risk of making mistakes, and it prevents liability actions from happening. It improves public health outcomes and improves the quality of patient care overall. It's been found to improve care in specific things such as asthma, and as well as transform the clinical process in the way that we deal with patient records, and also aids in diagnosis. Telemedicine, this is one of the newer things that have been around. We tried this also in the Bahamas. And this is something that will work well for our country because we're a country of islands. And so we have persons on all kinds of rocks and keys, and we're always trying to find ways to get doctors on these islands, but sometimes they're not available. So telemedicine is actually a future tool in a country like the Bahamas, where you can have a nurse practitioner or a GP or someone on an island, and they'll be able to just kind of conference in with a specialist, with a primary care physician, and they'll be able to kind of see everything that's going on with the patient and be able to upload all the diagnostics that are being done. So this is the future of primary care in medicine. And so I looked at Stanford University, which looked at what they called Primary Care 2.0, which was, their aim was to rethink and transform the way we practice. And they found that today's primary care field was somewhat broken, and they felt that you weren't getting enough time with the physician. So people were actually complaining they weren't having enough time with their provision provider, and the doctor wasn't having enough time to focus on wellness and prevention. And so they wanted to change their system. And so they came up with a system that would reduce the burnout for both the physician and give the patient what they needed. And they came up with what they call the ClickWell Care, which is a virtual online clinic staffed by Stanford physicians. And basically, they made it more accessible and convenient for patients to basically get almost 24-hour care. So now there were people in place who could see patients at any point in time, and they had a 90 to 95% rate of persons sticking with this program. And so it was a mix of both personal interaction with the doctors, phone calls, video streaming, and they found that the doctors are actually less burnt out because they could space out and see patients in different ways. And they also went into wellness coaching, where you had programs online or virtual programs where you had persons who were able to do nutritional sessions, training sessions, where they could be specific to one set of patients or a group of patients and help them with specific health goals like losing weight and training for a marathon. So instead of everyone having to come to the clinic, you can broadcast this, or you can have a specific interaction between the patient and a wellness coach, and they wouldn't have to even leave their home. Then we've got the home monitoring system. So smartphones are definitely a big part of all of this, and we're finding that they're creating actual tools that work at home where you can monitor yourself, do certain tests. The information goes straight to your phone and can be accessed by your doctor. And so these are future things to be implemented in terms of primary care. So here in the Bahamas, what is our situation here? So here in the Bahamas, we're just getting into this idea of medical homes. You have a lot of solo practices where people are out there just doing primary care. And so this is going to be a new phase for us, looking to change these things, as well as there's limited use of technology except for certain places like Doctor's Hospital, where they use a lot of technology, but a lot of smaller clinics do not. And why do we need primary care? Because the top causes of death in the country are ischemic heart disease, HIV/AIDS, stroke, diabetes, and hypertensive heart disease. So these are all things that really need preventative care. We have a high infant mortality rate, and we have low utilization of our essential services, and we have high rates of cancer. So things to focus on. This year from NHI, you can see that we're spending over $2,000 per person on healthcare. When we compare that to the other places in the region, we're spending 2, 3, 4, 5 times more than a lot of the other persons. And just like America, are we getting bang for our buck? Our life expectancy is about 75.5, where you have a country like Costa Rica who's spending about $943, and their life expectancy is 79.3. So we're spending, but what are we getting for it? Right? We look back at France, their life expectancy, 81 years. Okay, so they spend a lot more money, but they make a lot more money as well. So their GDP per capita is about $32,000. Ours is about 25 or 26,000. But they have a lot of physicians. So they have 34 physicians for every 10,000 in the population. Here in the Bahamas, it's about 13. And so we look here at NHI and what NHI is intending to bring to the Bahamas. And basically, they're saying that persons are spending more money who don't have any kind of health insurance, and that 1 in 3 Bahamians don't have any type of health insurance. And so they're trying to correct those particular problems. So you can see that some of the concepts for NHI are actually pretty positive and falling in line with the rest of the world and how they're changing their healthcare systems. So what is NHI? It's a new government program that ensures that all legal Bahamian residents, no matter your income, age, island or residence, or current health status, can receive healthcare free of cost at point of service. The cost for healthcare is paid for in full or in part by the government. Well, that's a trick, right? So yes, the government would be funding in terms of paying out the money to the persons, but the money has to come from somewhere. Now, the initial investment for NHI is about $100 million, and that's for primary care. And they said that's going to be no cost to you. But as you can see, in order for primary care to work properly, there's so many other elements that you need to be working as well. So if you're talking about quality primary care, that means that you have to have all those other components functioning properly, and that's going to cost you money. Right? So NHI versus what we call universal health care. So really our goal should be universal health care, which means that we have access and health care for everybody. So everybody can get their health care, and there's no problems of getting their health care, and it's high quality health care. NHI, however, is the driving force of paying for that health care. So that's only a component of universal health care. And like I said, you're going to need all those other things in order to make it work. the good things about NHI and how it's changing the landscape of healthcare in the country is basically it's pushing that primary care is first. So they recognize that the foundation to a good healthcare system is having a good primary care system. And they're looking to increase provider availability, as we saw, more providers, better healthcare, change the pay structure, so incentivizing the way that we do the healthcare system in terms of primary care, creating the aspect of the medical home, increasing spending, okay, and also bringing in what we call a public insurer so that people have options. So you can get private insurance, you can get public insurance, and so those are all positive things. Now remember that the problem with the US had was efficiency. So these are all good elements, but we also have to look at how efficiently that we're going to get these things done. So the concept of NHI is actually pretty good and pretty progressive. And they do embrace this whole idea of a patient-centered, community-centered approach. As you can see here, all the components that we talked about are part of their model. And right here in black, you can see primary care. The family physician, doctors like myself, are the key component to their primary care. And so this came from Dr. Brennan, who's the NHI project manager. And he said, the goal of NHI Bahamas is simple. It is about better, healthier lifestyles for Bahamians. So this sounds great. I mean, this sounds like exactly what we're talking about. However, if you look back at all the things that we've discussed, you need the policies in place in order to drive this. You need the proper funding to drive this, and you need proper patient education. So these are really good components that they're talking about healthcare. And if we were just to go on the model that they suggest, we would have a better healthcare system. Now, the efficiency and the management of that, we have to be cautious of that, because as we've heard, right now we currently waste about 25% of everything that we spend on healthcare. And we're talking about putting more money in without kind of fixing the systems that are driving it. So that is a cautionary tale that we have to look out. We don't want to be like the US, where we're just spending more money and not getting bang for our buck. So basically, the strategies for change in the healthcare system, and I'm going to wrap up, is achieving good primary care. Primary care is essential to the future of healthcare. And so we want to avoid the excess of specialists whilst having a balance. We want to have equity in health. And we want to use primary care to address comorbidities and multiple morbidities that we're seeing in our population. We want to respond to the patient's problems using proper IT systems, and we want coordinated care, as well as avoiding as much adverse effects as possible. And so we have to look at our payment schemes, we have to look at the way that we looked at healthcare, we have to make primary care the focus of our care, and we have to link primary care to disease prevention, which is a major issue in this country. And so if we focus on those things, the future of primary care looks very bright in the Bahamas if we were to do these things properly and basically have the processes in place. And so the future of primary care is basically the future of healthcare. And so thank you.